Hello everyone, I am Dr. Deepak Thakur, Senior Consultant Pediatric and Fetal Cardiology at Fortis Hospital, Gurgaon, Manesar. So on the occasion of Children's Day, for all my dear kids who are growing up, we have to know this thing that the heart health starts right from the womb of the mother. So on this Children's Day, my message will be for the awareness of congenital heart defects. Congenital heart defects are the defects which are present in the structure of the heart. It can be in the form of the hole in the heart, a blockage in the valve, a blockage in the vessel, and abnormal connections between the vessels and the chambers of the heart. So all these kind of congenital heart defects can be easily detected during the antenatal scans, that is fetal echocardiography, which is done between 18 to 22 weeks of pregnancy. And to everyone's surprise, among all the congenital defects, the congenital heart defect is the most common. And the good news is that more than 95% of these congenital heart defects are easily curable with one-time treatment. So the symptoms which you have to look for in your child, if you are suspecting any heart disease in your newborn baby or a grown-up child, is whether the child is having any breathing difficulty, any persistent chest pain, any inability to match the peer group in the activities. A newborn baby, if the baby is turning blue on crying or is having inadequate weight gain or recurrent infections, do get your child evaluated for congenital heart defect. There is simple investigation to detect these heart defects, that is echocardiography. It's a painless procedure, just a jelly is used, no radiation exposure. Within 10 minutes you can get accurate diagnosis whether your child is suffering from congenital heart defect. Why it is important? Because timely detection of these defects or any abnormality in the heart is very important in the early life, because sooner you give the treatment for these defects, the better the results are, and the child can have a very meaningful and a fruitful life just like you or me without any ailments later on. As I told you, more than 95% of these defects are curable. The cure can be procured in the form of surgery or intervention. Intervention is done without opening the chest of the child by angiography or angioplasty, just like we do in adults. So in pediatry, we close the holes using the devices, we open the valve and the vessels using the balloons, or the stents. So these are the simple techniques through which, without opening the chest of the child, we can treat the child with the congenital heart defect. Surgery nowadays, with the advancement of the bypass machines and the advanced teams we have, surgery is very simple in the congenital heart defect. Usually the babies get discharged within 4 days. The scar are minimal because subcuticular suturings are done by the surgeons, which give the minimal scar on the child's body. Talking about the advancement in congenital heart defect, a lot of interventions are coming up, a lot of hardwares are being researched which can impart non-surgical cure for these congenital heart defect. And if I talk about the surgery, robotics are coming in a big way. Total endoscopic surgeries nowadays are done at the best of the centers across the country. So you can always get a guidance through your pediatricians or through your doctors, which are the best centers you can go to get your child cure for the congenital heart defects. Talking about the long term, as I told you, once these defects are cured, more than 95% doesn't need a long term follow-up. Just a few years of follow-up later on, and then there is no further medications or the long term follow-ups are required.